COVID-19 continues to wreak havoc across the globe, and with the new Omicron variant spreading rampantly across the Bahamas, almost every household in the country has been affected. Just recently, health officials recorded an alarming 818 cases of COVID in only one day, and islands that were once COVID-free are now seeing the virus show up. Very distressing, to say the least. It's a balancing act around the world. Governments are facing a dilemma of a healthy nation versus a healthy economy. Can they coexist? Hello and welcome to On the Record, our season opener. I'm your host, Jerome Sawyer. Globally, there are over 300 million cases of COVID-19 recorded, and locally, more than 30,000 Bahamians have been affected. And more tragically, the Bahamas has recorded over 700 deaths due to COVID-19. My guests, the Registrar, Dr. Philip Swan, and the Director of the National HIV/AIDS and Infectious Disease Program, Dr. Nakia Forbes. Our topic, COVID-19, the current state of affairs. Happy New Year, and welcome to Season 6 of On the Record. See you on the other side of this break. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. Welcome back to On the Record. Tonight we discuss COVID-19, the current state of affairs. Our guest in this first half is the Director of the National HIV/AIDS and Infectious Disease Program, Dr. Nakia Forbes. Dr. Forbes, welcome as always to On the Record. It's been a minute since we've had this conversation, but certainly the circumstances now precipitate that we be back here, or we come back here to have this discussion. Good to see you again.
Always good to see you, Mr. Sawyer. Thank you for the invitation. It's a pleasure to be with you.
So, Dr. Forbes, we seem to be at the height of our fourth wave. We have never seen such high numbers. Are these numbers a reflection of more testing, or are we just at that place where we have this many infections?
So what we are experiencing right now is the Omicron virus. That is a strain of COVID-19 that is very infectious. It's the most infectious strain to date. And that largely is what is accounting for this surge in cases. And this is also happening just after the holiday period. And that is probably contributing to the numbers that we're seeing too.
What are the characteristics of Omicron, and how do these characteristics differ from that of the Delta variant, which would have been responsible for the previous wave?
Sure. So Omicron is very contagious. So the original strain of COVID-19, Delta, was 3 or 4 times more contagious than that original strain. And Omicron is about 3 times more contagious than Delta. And so it's easily spread from person to person, and it does cause flu and cold-like symptoms largely, but people who have weak immune systems can also run into trouble with shortness of breath with this Omicron strain.
We have not, though, seen the level of deaths, although the numbers are high, and I may be wrong on this, but it appears that we do not have the same level of mortality, or the mortality rate is not as high. Is that a positive thing at this point?
Well, let's look at what the science tells us about this. What we know so far is that Omicron really is more in the upper respiratory tract, the nose, the throat, the mouth, the salivary glands, and it's less likely to have a large amount of virus in the lungs like the Delta strain and the original COVID-19 strain. And so there's information that Omicron can be less severe for both vaccinated and unvaccinated persons because of that quality. Here's what the kicker is with Omicron. Because it's so contagious, many more people will be sick. And so even though the severity may be less, if you have double or even 4 times the number of people sick at any given time, more people will be infected, and many of them will have medical problems which make them vulnerable should they get COVID. And so the benefit of having a less severe strain, the benefit of that washes out a little bit in some context. If you have more people being sick, more people being hospitalized, and so your hospitals can still be over capacity and over pressure. And that is what is directly contributed to when we see that patients are ending up having a hard time and ending up dying from COVID-19. Now, in no way, shape, or form is Omicron mild for people who are at risk. There are many people who will get Omicron who will still end up needing respiratory support or even on a ventilator.
If you can help us to understand the experience for those who are vaccinated and unvaccinated, because one of the things about this virus is even though you are vaccinated, you are still susceptible to contracting this virus. But what does the science tell us about the experiences of those who are vaccinated versus unvaccinated?
Absolutely. So the point of vaccination is that it will protect you to some degree from getting COVID. Omicron can cause breakthrough infection. We're going to come back to that point. However, vaccines are also very protective to protect against hospitalizations and deaths from COVID-19. However, there are unvaccinated persons who may still run into trouble with COVID-19, including Omicron. And we are still seeing patients in the hospital system that have to be on ventilators and supplemental oxygen with shortness of breath because of COVID-19. Now, let me be clear. Over time, viruses can mutate. Viruses do mutate. And that can result in a strain that vaccines and therapeutics may not be as effective against. And so in that case, we can have so-called breakthrough infection in vaccinated persons However, if these infections are mild, just cold and flu-like symptoms, you'll get better. You won't end up in a situation where you end up in a hospital needing to be on a ventilator or short of breath for the most part.
The experts also advise, too, that if you are eligible for the booster, if you are at the point where you can take a booster, they are advising that we take the booster. But other countries are advising that another should be taken. Are we going to get to a point, do you think, where we will be taking these boosters on an annual basis, as we do, let's say, with the flu shot?
That's a great question. And the first thing I have to clearly state is that science has to guide this. And so with COVID-19, as we get more experience with the virus, it became clear that immunity could wane over a certain period of time, and that a booster dose could build the antibody levels back up, and that could be protective in terms of protecting against getting another infection, for example, or ending up in hospital or having to be on oxygen or dying, for example. So it's not clear how many boosters would need to be given, or would it need to be given. Multiple doses need to be given. So we have to wait and see what the scientific data says in that regard. However, there are many other vaccines where we get more than one dose. For example, the flu. The flu circulates the globe. There are various strains that come up every year, and it is recommended that you get an annual flu shot. We are not saying that that will be the case with COVID-19. We will have to wait and see what the scientific data says.
Very good advice. I think we're going to take our break, but I think sometimes we forget that we've been dealing with viruses and vaccines over the years. It just seems sometimes like we forget, like this is an isolated case. So thank you for reminding us. We're going to pause right here for a quick break here on The Record. Stay with us. We are back right after this. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. And we're back with more On the Record. This is our season opener. Our discussion tonight is COVID-19, the current state of affairs. And our guest in this half of the show is Dr. Nakia Forbes. She's the director of the National HIV/AIDS and Infectious Disease Program. Dr. Forbes, last evening the government announced the return of some in-person classes for schools. What kinds of risks are involved here when you're talking about having kids and teachers now back in the classroom at some level?
That's a great question, Mr. Sawyer. So let's talk about what the science tells us about COVID-19 in schools. So, in the 2 years that we have been living with COVID 19, there are experiences and studies that tell us about COVID 19 in schools. And it's very important that schools have protocols to mitigate against COVID 19. And when schools are able to do that effectively, the amount of COVID in schools actually can be lower than the community. And it's very important to note that those mitigation steps and protocols must be in place, and even very young students can follow those steps, like mask wearing, especially when you present it in an age appropriate way. And so there are key strategies like staying home when you're sick, vaccination. Everyone who's eligible for a vaccination should get that to try and reduce the number of persons who are at risk for COVID in the schools. Mandatory mask wearing, both the teachers and the students, distancing in the classrooms, a clear strategy for if someone does get COVID, for isolation and quarantine and follow-up testing, and that can be very, very successful. There is good data and studies that show that there were no situations where there was a lot of transmission when persons did follow the protocols. Now, there were problems when the protocols were not followed. And then there are case reports of transmission, for example. And so it can be done, especially if those protocols are well followed. And then we have to look at things like the social benefit and the educational benefit of having children in schools.
And you know, it keeps coming back to protocols, protocols, protocols. I mean, this is what the scientists, the medical experts have been preaching from day one, the protocols. But you know, as humans, I think we just naturally sort of we lower our guards. It's a natural thing that we have to do, and so it's important, I think, that we constantly remind people. Let's also talk a little bit about the eligibility of children for vaccines. Not all children are eligible, but some are eligible. Just remind everybody where we are with the vaccination of our children at this point.
Right. So there are vaccines in our country that are available for children ages 12 years and older. There are also other countries that do have the COVID vaccines that can be used for children of a younger age, 5 years in age and above. We are lobbying and wanting to get those vaccines. So these vaccines for children are also safe and effective. The pros for vaccination for this age group include the fact that we know that children can get COVID-19. A small percentage of them might have a complicated course. And there's that multi-system inflammatory syndrome in children that's very, very serious. Not many of them get it, but there are children that can get it, and vaccination can reduce the chance of them getting COVID-19 and that happening, for example. And then overall, when we look at good vaccination coverage, it can help in countries and worldwide get a better handle on the COVID-19 situation to reduce disruptions in services, school, and life as we know it, which is overall better for the lives of all of us, including children, the psychological benefit of being in schools and among their peers. And so those are some of the things that experts lobby for when we consider childhood vaccines.
Like adults, there are children who are at risk as well, who are immune compromised or who have pre-existing conditions. I want you to remind the public as well of the children and the types of things that, or the types of pre-existing conditions that can make children vulnerable to long-term effects or worst possible outcome if they contract this virus.
So children generally will have a milder course with COVID-19 than adults. It's just the fact. They're less likely to get sick and have a serious complication. However, there are reports where children can get very sick, and some have even died from COVID-19. It is more likely to happen in children who have another medical problem. However, there are healthy children who have gotten COVID-19 and have had a severe complication or course.
Okay. I want to look at where we are, in all of this. Last year, it took the Bahamas months and months to be able to identify the Delta variant, which really made a lot of people sick and took a lot of lives. Are things different now? Are we able to get on top of identifying which variant is affecting us and at what rate? And I guess akin to that too is the Delta variant still prevalent among the cases that we're seeing?
So Delta strain of COVID is still in country and circulating in many places. And certainly people are still having a very hard time with Delta. What we know is that the predominant circulating strain of COVID-19 is Omicron in most places right now, including in our immediate neighbor, the United States. In-country capacity for identifying strains is being built upon, and the National Reference Lab is improving their platform for identifying these strains. They're able to identify some of the genes that are associated with resistant strains, but to the best of my knowledge, it's still a send out for the final confirmatory testing for us to confirm the resistant variant.
Across the United Kingdom, COVID-related restrictions are changing rapidly. It's almost as if the UK is putting in measures for its citizens to adjust to living with the presence of the disease. Are we moving towards that here in this country? And is this the best course of action to take at this point? I think I've seen articles or references where they said, it's almost like now living with the flu. Is that something you think that we're going to move towards even in this country?
The important thing to note is that COVID-19 is not going to go away. It's been in the world for over 2 years now. And so what we are seeing is a shift toward living with COVID-19. So, Mr. Sawyer, thank you very much for asking the question with the example of the United Kingdom and long-term strategies for living with COVID-19. And that is what that has to be categorized as. Mm-hmm. So let's talk about that because we did kind of have a little bit of a discussion before we started to become on the show. And so what has been rolled back is that the vaccination passport in the United Kingdom is no longer going to be considered mandatory. And organizations can use it voluntarily. So what was that Vax passport? It meant that for persons to enter certain communal settings like nightclubs or go to a large indoor communal setting, say with large numbers of people, or outdoor with large numbers of people, that a Vax pass had to be shown. And that Vax pass indicated that person was fully vaccinated and that they had a negative COVID test within 48 hours. So that's no longer going to be mandatory as per the law, but organizations can apply it. The second thing in that example is that the public service will return to work in that country. There will no longer be a mandatory mask mandate where people can be penalized and have a criminal offense if that is not done. And the shift has been to asking persons to take personal responsibility for their safety and the safety of others, and to be careful and considerate. And so the context of this is that the shift for keeping oneself safe with COVID And our larger responsibility to our society has shifted or becoming more shifted to personal responsibility instead of mandates and rules. And so you'll see that many countries are rolling back restrictions, including in our country, restrictions have been rolled back. It doesn't mean that there's no precautions and that you throw caution to the wind, that it is that personal responsibility is something that is being underscored, and we have to do that. COVID-19 has been around for 2 years and it's not going away. And so when we think about the context of this, it's not saying don't take any precautions at all.
Dr. Forbes, thank you so very much. I think, what is standing out to me, as it has always stood out from the very beginning, it's about personal responsibility at the end of the day. Thank you so very much. It certainly has been our pleasure having you on and taking part in tonight's discussion. As always, you bring great information. All the best, and we hope to see you here again soon. Hopefully, we'll have a little better conversation at that point. Hopefully, things will be a lot better for all of us.
My pleasure being here. Thank you for inviting me. Take care and stay safe.
All right.
Bye, everyone.
Thank you so much. We are going to take a break here, and when we come back, Registrar Dr. Philip Swan will join our discussion on COVID-19, the current state of our affairs. Stay with us. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. Welcome back to On the Record. Our guest in this second half of the show is the Registrar, Ministry of Health, Dr. Philip Swan. Welcome, sir. Glad to have you with us.
Thank you for welcoming.
Now, the Ministry of Education has announced the return of in-person learning, something that a lot of parents have been waiting to hear about, a lot of concern, anxiety, however, depending on what side of the debate you're on. What are the guidelines given for this from the ministry's perspective? How have you guided this process?
So we've worked with the Ministry of Education from day one to COVID-19 and trying to get students back to school in a safe manner. Also keep teachers safe as well as the homes that they come from as well. So we initially had a series of discussions with the Ministry of Education and looked at the protocols that they had developed and to ensure that the generally accepted precautionary and safety measures were included in those protocols. And so that was how we worked along with them, specifically in trying to ensure that the school environment did not become a nidus for infection or clusters or outbreaks.
Mm-hmm. What are some of the critical protocols or main protocols that are going to be instituted?
So I would say to you there's nothing new that's going to be instituted within the educational system. These are things that have been already approved or agreed on earlier on. Mm-hmm. But specifically to what we're asking education to try to promote is vaccination among all persons who are eligible to get the vaccine. So you're talking to children who are 12 years to 17, adults as well, across the campus. Mm-hmm. In addition to that, we want them to continue the screening protocols that they had in place prior to COVID-19, well, this last break, I guess you can say. So that, because what they did before was protective enough, we felt. It didn't have any challenges with it. We had no outbreaks. There were no concerns in the school settings for the most part. In addition to that, we'd asked them to just have a closer register, I guess you can say, on students who are in the classroom setting. So if that there is a case on campus, on exposure on campus, we're able to know who could be possibly impacted and have a quicker response to those individuals.
Where are we with bringing vaccinations in for younger children? As it stands now, it's those 12 and older.
Correct.
But in other countries, vaccines are being given to children who are younger. We have not gotten to that place yet as a country. Any update, any idea on where we are?
Well, we have been asking, because we don't make vaccines, we've been asking, and I mean, most of the most accessible vaccines is the Pfizer vaccine for children. It's a different formulation than the adult vaccine, so it's not just giving them half of the dose. It's a different formulation altogether because of the reaction to the children. Mm-hmm. We have not been successful in accessing that vaccine. We have feelers all out, private sector, directly to the manufacturers through a group from CARICOM. But we understand that just on the ground, there are some challenges with supply in the U.S. as well. So, because of course some of us have relatives over there, and in some cases, the pediatricians don't have access to those vaccines.
I mean, I was going to ask, what seems to be, what is prohibiting us from getting them when they are available in other countries? So it could be a supply. It sounds like it's a supply issue.
Right, it is a supply issue.
Okay.
Definitely, this is a supply issue. I don't think they're able to make as many vaccines to cover their own population and then to use the vaccine diplomacy method of giving it to other countries.
Interesting. Are Bahamians really taking this COVID-19 situation seriously? And by that, I'm also asking, is there enough being done to let them know how serious this virus can be? And I'll tell you how I got to this point. Mm-hmm. A year ago, we were all laser focused on COVID and the protocols and et cetera. Vaccines have now been introduced. We are living with it a little better, but I don't sense that the level of seriousness and concern is still there. Is that natural, or do we need to really get more focus on this again?
It is natural. I'm sure I've been tired of hearing this phraseology of COVID fatigue. Mm-hmm. But the challenge is that we're not in a challenge. And with time comes information.
Sure.
As well comes misinformation. Mm-hmm. And social media has been a ready vehicle for both information and misinformation. But persons like misinformation more because it's more juicy, it's more saucier. So let's focus on that, let's share that more. Mm-hmm. Because the information that really protects individuals have not changed much since day one. Vaccinations have been added to the armamentarium, as you mentioned, but if you look at it, it's the same protocols: physical distance, wearing your masks, hand sanitization as much as possible. With those basic features, for the most part, you will prevent many of the infections that are happening. So when you look at what's happening in the community now, you see persons walking around without masks. And I know we're not wearing masks in this setting, but because of certain protocols have been taken into place. But when persons are sitting, walking about the community, they're in bars and restaurants, in close quarters, socializing at work, they're not wearing their masks, and therefore they are unwittingly being exposed and exposing others to infections. And this is why we're seeing such an increase that we're having now. So persons are tired of wearing the mask, yes, but persons have to understand that this is still what is the best measure of protection.
Do you think, though, that between the vaccinations and even the drop in numbers at one point, that gave us a false sense of security?
Well, yes, I would say a false sense of security gave us a sense of security. Was it false at that time? Probably not, but as time went on, and so there's a way of responding and being iterative in your response or dynamic in your behavior, so that if you're seeing or being advised to take a different approach because of what's coming down the pipeline, then you do that. But if if you're not flexible enough, then we end up in situations where we are not necessarily benefiting from the preventive measures and the policies that may protect us going on.
The government would have procured services of nurses from Cuba recently to help deal with the overflow of the COVID-19 patients and the rise in cases and the strain on the hospital. Are you able to give us some specifics on sort of how they're going to be able to help with this, with what we see as a strain on our medical facilities? So
what we have, and I think this would have been in the news by Dr. Forbes as well, what we've recognized is that even though our hospitalization, our cases are not necessarily ill, they still require care, they still require isolation from the other population patient population in the hospital. So what we anticipate that the nurses that were brought in will do is alleviate some of that, allow them to be deployed to other areas of the hospital that may require, who have non-COVID patients as well as COVID patients. And as well as some of the things that we'd ask the hospital to take a look at as well is how do you maximize your skilled staff to provide the services that you need and bring in some lesser skilled staff to provide some of the things that nurses don't necessarily have to do. And I think once we're at that stage where that is implemented, we'll even get a greater relief from the burden and challenge that's happening in the hospital system at this point.
There have been accusations in some quarters of the public that previously there was underreporting. Under the previous administration, people weren't getting the proper numbers or the accurate numbers. There were more cases than were being reported. Can you respond to that? And are we truly seeing or what assurances can you give us that we are and have been seeing accurate numbers of cases?
So in any pandemic, in any infective process, any disease process, there are criteria that you use to determine whether or not this meets the mark, so to speak. The Bahamas government and Ministry of Health has determined what that mark is going to be for the country, which is the RT-PCR test result. Rapid antigen test is also another test that is available for a screening measure, but it's not diagnostic in our setting. So what we report are RT-PCR tests. These are some of the test results that are also reported in other jurisdictions like the United Kingdom, and they take basically what the country recognizes as a diagnosed case, and then using that information, that is what reported to the public. Other markers, of course, that we look at to determine how we respond and how we manage the pandemic. We take a look at the rapid antigen test numbers, we take a look at hospitalizations, we take a look at persons, the death rates and all those other kind of indicators to help us to manage the pandemic. But what we may use as the gold standard, I guess you can say, across the board is the RT-PCR, because that's what most countries use, and we want to make sure that when we're talking about numbers across countries, we're talking about the same thing.
Interesting. Sir, we're going to take a break. This is our final break in the show. We are talking with Registrar Dr. Philip Swan. When we return, we continue our discussion on the topic COVID-19, the current state of affairs. We're back right after this. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. Welcome back to On the Record. My guest is the Registrar of the Ministry of Health, Dr. Philip Swan. We are continuing with our discussion tonight. COVID-19, the current state of affairs. Dr. Swan, what is it like, I call it being in the belly of all of this, being in the Ministry of Health, having to monitor this changing situation almost daily? I remember when we first started out on this COVID journey, when masks were optional. And I look back now and I think to myself, this is almost a daily changing, evolving situation. How does one really deal with that? How do you remain focused and not get exhausted, if that is even possible? How do you sort of manage all of this when it's changing daily? And the public is looking at you and going, well, just yesterday we said this, but today it's that.
Right, and it's interesting that you said that about the mask issue. Mask has always been recommended. I think the message that sometimes gets out, usually by social media and by other persons who have the louder voices, is countercurrent to what is the actual science. And sometimes it's because persons are trying to make it look, more appealing, to get persons to, I don't know what they're trying to do, but science is the science. And we've always said, it's like the flu, and if you can wear a mask to protect yourself from the flu, like we do in hospital settings, then, someone comes into the hospital coughing, you put on a mask. And because you don't want them to you put a mask on them to keep their stuff with them and to keep them from getting you. So it always has been masks to protect you. But it is tiring. And I mean, I wouldn't lie to you and say it isn't. It's just a 24/7-day-a-week work. It has changed the dynamics in a number of families of persons who have been on the front line, not just persons who are working in a hospital setting, but from the Ministry of Health side, the public health side, trying to look at the data. How do you see what's happening in other parts of the world? What the science is saying about the vaccines, what's saying about the infection, or the cost of illness in hospitals, trying to get that same information from your clinicians at home so you can have the information, the data necessary to make the types of decisions and give the types of advice that you would need to or you would want to give the best fit your situation. Sure. Sometimes that information has not been available, and so if you don't have that information, sometimes you say, well, pause, let's see what's happening before we can make this decision. So persons are crying for action, 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 and saying, but we can't act as we don't know exactly what's going on at this point in time. So, some of those things are some of the frustrations of the public and some of the frustrations of the healthcare provider as well as the public health specialists. But, through the grace of God, here we are almost 2 years later, hopefully in a better state than we were last year this time. Well, I can't say that last year we kind of low this time, but we're coming down again from where we were earlier. And our numbers seem to be showing a better picture than we looked at 2 or 3 weeks ago.
I was just about to ask that as well. Do we seem to be now on the downside of? Does it appear that we have peaked and are coming down?
It appears that way, based on the numbers that we have in thus far, and that's even including the numbers that we take in consideration for the rapid antigen test. Right. But the challenge that we are seeing is that our hospitalization numbers are still climbing, even though our positive cases numbers are coming down. And last week it was about half the week before, and right now it's probably trending for the same half of that week. So we definitely have had a precipitous up and down, what we're looking for. But we're still looking at the fact that our hospitalizations are still higher than what we'd like them to be. They're not necessarily ill, but they're still in hospital.
This virus continues to mutate. And because of that, the circumstances change. Is it, are we going to see a situation where every so often you think we're going to have a different mutation of this?
So the short answer is yes. And I say that because even though we don't pay much attention to it, the flu virus is similar. You have mutations on a regular basis. It's just that we are more, acceptable of what happens with the flu virus. It's not news because it's not new. But the flu virus mutates on a regular basis, and every year the flu vaccine is a different makeup from the year before. Depends on what happened in that season the prior year. So we are coming to the point where we are going to get a little, I guess you can say, numb with the types of variations, and we're hoping that once persons understand that the virus has the same mode of transmission, regardless of whether it's alpha, it's delta, it's mu, it's gamma, the same protective measures must be taken. And once we get to that point, I think we will have less of a excitement, I guess you can say, when, quote unquote, we are encountered with it.
One of the things that we have seen with the new government coming in place is they've done away with the lockdowns and the curfews and some of the more strict measures, but yet we are in a fourth wave. Do you think we're ever going to get back to that point of having those very strict measures, or are we going to see more of what's happening in Europe and in other places where we have just decided that, or where they've decided, you know what, we are just going to have to live with this, whatever it is?
Yeah, so I think that the most honorable Prime Minister actually made a shot across the bow when he said we're not going to do any more lockdowns. And I think that kind of forecasted the direction that this administration was going to take with the management of COVID-19. I don't know if you would have seen the clip that was circulating from the Prime Minister in Britain yesterday, how they're doing with masks, doing with all of these other types of restrictions. And that was circulated in some circles as well. That's a policy decision. I'm not sure. I'm certain that the Prime Minister of Great Britain did not go to NHS and NHS say this is what you must do. And this is a policy decision that was made by politicians. So what we do is we try to manage based on what we're faced with. If the policy is X, Y, Z, how do we ensure that as far as possible we maximize the health protective measures based on what is being advanced? Because there are certain things that there's no need to arguing and fighting about. It is what it is. Deal with it and see what is the best advice you can give in view of what it is you're faced with. Now, you still give what your recommendations are, but understand that you are giving recommendations based on what you feel is best. It's not necessarily the last or the only thing taken in consideration when the decision is made.
Even though we have done away with a lot of the stringent measures, there are some things that are still in place and ought to be enforced.
Right.
Do we have enough enforcement? I don't personally see it. I know there was a time you saw the COVID police everywhere.
Correct.
And I just want to see them driving up and down.
Correct.
But are the measures that are there, are they being enforced?
I think to some extent they are. As to the extent that they are able to do so, that's definitely a question for national security to answer. We have our ideas on what could possibly be done more, but of course, you're also seeing some other things that are popping up. When we did have the restrictions, there was less crime, for example. So there's less, quote unquote, we call it distractions, but this is the focus of the force, right? To fight crime, or real crime, as they put it, as opposed to monitoring the adherence to COVID measures. I think we're at the point where, as a population, we have to put on our big boy pants, our big girl drawers, and understand that we have responsibilities, individual responsibilities. You should not require an individual to tell you as an adult to put on your mask, to hand sanitize. These are things that you must do in order to protect yourself and society. So, I can understand the frustration of a police officer feeling that my job is to tell this big, gray, quote-unquote, gray hip man to put on his mask when he has children and grandchildren.
To save his own life. And
right, exactly. So, so some of that is also the frustration as well as the fatigue on the police force side as well. Because here it is on this side, you have to talk to this man to put on his mask, and around the corner, someone's getting shot. Where are your priorities? What is the public expecting of you to do?
And the police's job shouldn't be to really, in today's society, to tell you life-saving things.
Exactly.
That we've been telling you for 2 years.
Exactly. And not to just tell you it, but where it has been demonstrated that these are life-saving measures, but yet you feel that you don't want to do it, but you want the police to tell you to do it.
Interesting. Dr. Swan, thank you very much for coming on. I think that's a good way for us to end. I ended with my last guest. We're talking about personal responsibility.
Right.
And that's what it really boils down to.
Correct.
At the end of the day. We all have individual responsibilities that we must see through and that we must stick to. So hopefully the message resonates a little bit more.
Okay.
We'll see. All right, Dr. Swan, thank you very much. We are out of time. It has been a pleasure having both my guests on. We'd like to thank Dr. Forbes in our previous segment as well. That's going to do it for this episode of On the Record tonight. I want to say special thanks to the entire production and technical team. Always a pleasure. We are back. This is season 6. We're off and running to a great season. Be sure and tune in next Thursday for another great discussion right here on The Record. We'll see you then.